know that everybody's back to school. It's a big, interesting time of year, specifically because this is kind of the first normal, to use the air quote, a back to school that we've had in a couple of years. We all know why, because of the pandemic. Joining us to discuss all of this is IWK clinical psychologist Lindsay Human. Doctor, thanks so much for joining us. We appreciate your time.
Oh, my pleasure.
All right. So when it comes to back to school jitters, they're normal under any circumstance, but I would assume that that's kind of magnified based on what we've been through. What's your take on all of this?
Exactly. Yeah, it's been a whirlwind of a few years with the pandemic. So I think, children and parents are a little apprehensive about what to expect this year. So you always have the normal back to school jitters and worries every year. But I think this year it's probably a little bit more amplified with the uncertainty of the last couple of years.
All right. So what's some advice as to how to kind of deal with all of this?
The best thing for kids, especially if they're going back to school or maybe even starting school for the first time, is to just try to be honest and prepare them as best as you can. So I think, most kids are back in school already, but usually, just talking about what the day is going to look like and who their teacher is and really just normalizing that. It's actually okay to have some anxiety. It's really normal. Most people do. And for most kids, that'll usually subside over the first couple of days or weeks. So I think the key thing really in this case is to really make sure that even if they have anxiety or worries, even if they're crying or there's tears, to really make sure that they still go to school, that they stay for the full day, and then that they kind of have some time at the end of the day to unwind.
Yeah, and routine is important as well, right? That's important for anybody, but for kids especially, I would think that having a routine and all of that's got to be important. Can you expand on that?
Sure, yeah. So I think, after the summer, sometimes our sleep's got a little out of whack and bedtimes, and that's pretty normal. But I think now having that routine of, getting back into a good nighttime routine, a good, getting enough sleep, making sure that they wake up in time to have a good breakfast and not feel too rushed in the morning. I mean, that's a challenge for lots of families, but I think just having that predictability can be really important for kids as well. Just to have that kind of, that they know what to expect in the day, and that they have, again, at the end of the school day, some time to kind of come down and unwind from it as well.
How about the dynamic that students and kids have with their teachers? Obviously, teachers make a big impact on kids' lives. Certainly myself, that was applicable. But what can you tell us about that? And can that be fostered in some way, that dynamic of what each, because kids are, we all know, individuals, and individuals have different needs. So what are your thoughts on all of that?
Yeah, I mean, teachers are amazing. They deal with so many different situations and different personalities. So I think, most teachers are really open and wanting to learn about your child. So, my children are going back to school too, and their teachers sent a, form, let us get to know your child. And I think that's important to share your child's strengths, but also some maybe areas that they might struggle with. So if your child does have some anxiety about the first week of school or different areas where they're anxious, it's okay and a good thing to sort of share that with their teacher, so that the teacher's, aware of that and can help support them at school. Because really, we want the children to be able to deal with any of those worries and anxieties at school and not feel like they always have to call back home or talk to their parents or leave school to deal with that. So I think just, being able to have that open communication with the teachers and to have those check-ins is really important.
What about expectations? We know social media has added a lot to all of this, and I understand that people like to post photographs of, and we see it all over social media, and I'm not criticizing people for doing that, by the way, but what's that add to all of this? Social media and expectations and appearances and all of that, is that at play here? What are your thoughts?
Yeah, I mean, it's so common, and I know parents are excited and, it's really common. But I think, most people, if we know, one thing about social media, people are often posting the highlight reels, right? They're posting the pictures of their kiddos excited and smiles. But what people aren't posting is the other stuff, the tears, the worries, maybe that's the children's tears, maybe it's the parents' tears of feeling worried. So I think just remembering that, we're not seeing the full picture on social media, and it's more people than not are feeling some anxiety these first few weeks too. So just keeping that in mind is really important, have a realistic perspective of it all.
How about when it comes to kids in general and medication and when medication? Because we hear again anecdotally. I don't know what the data would tell us. You would certainly be much more plugged in with this than I am. But you hear that more and more kids are on anxiety meds and whatever form they might be and in therapy. Look, I'm 53 years old, so when I was a kid, I mean, the stigma and the awareness was non-existent. It just, I didn't know anybody in therapy when I was a kid, and that's not a good thing. I'm not suggesting that's the good old days, the way it should be. Please don't misinterpret. But what are your thoughts on when that might be necessary, and might that be perhaps go to too rapidly in some cases?
Yeah, so it's a great question. I think, first of all, like most people have some level of anxiety, so we don't want to, it's okay to normalize that, most people are going to have periods of time when they're anxious, and certainly at the start of the school year, it's a time where nerves are high. So, we really would talk more about treatment for anxiety, or especially, medication down the road when there's, when it's usually an anxiety disorder. So when the anxiety is, more greater or unrealistic given the situation, and anxiety that's at that level would be really much more severe. It would cause a lot of impairment. It would last a lot longer than those, couple of days or a week. So if that's the case, we usually encourage children and parents to seek out treatment. With children, the first line treatment is really more of a therapeutic approach, and so it's not usually that they'll start off with medication. So there's lots of different therapies. For example, cognitive behavioral therapy is one of the first line treatments for anxiety, and it often involves sort of teaching kids and parents different strategies, so to maybe recognize and challenge some of their anxious thoughts. But the real key ingredient of that is really focused on exposure. So usually when we're anxious, we avoid things. It's kind of our go-to reaction and really normal, but avoidance really only makes the anxiety better very short term, and in fact, it makes the anxiety a lot worse long term. So most key treatments for anxiety will focus on really helping the children to gradually face those fear things. So we call that gradual exposure or step ladders, where, for example, at school, it's like, how can you gradually, start facing that, or if there's something else they're avoiding. So usually that works for most kids if they kind of get a track of that kind of cognitive behavioral therapy or CBT. For some kids and teenagers, there is a role for medication. It'd be important to talk to, the doctors or therapists about that. And, if it's really extreme or it's not responding to therapy, then that's something to definitely consider. And even with medication, I'm not a medical doctor, as a psychologist, but, medication is not necessarily meant to be long-term either. It's sometimes just to help them be able to get more out of the treatment too. But for, I say, most people, even with anxiety disorders with children, the therapy itself is sufficient.
Appreciate your time. Thank you so much. Good chat.
No problem. Take care.
All right, take care. IWK clinical psychologist Lindsay Human.